The fluorescent lights of Grace Memorial Hospital's trauma bay buzzed with a sound like dying wasps at 2 in the morning. The witching hour. The time when the living felt most vulnerable and the dead seemed closest. Nora Kincaid was on her knees, not in prayer, not in defeat, just scrubbing. The mop moved in careful circles across the linoleum, pushing pink-tinged water toward the drain. Blood. Always blood. It pooled in the grout lines, settled in the corners where the floor met the walls, left rust-colored halos that took 3 passes to erase. She was 52 years old. Her knees cracked when she stood. Her lower back held a constellation of titanium screws that ached before rain. Her hands trembled when they were still not from age or weakness, but from muscle memory. The phantom vibration of helicopter rotors that never quite faded even after 5 years of silence. The trauma bay doors swung open. Voices, laughter. The sharp chemical smell of success mixed with exhaustion. Dr. Marcus Sterling led the pack, still wearing his surgical cap, his scrubs pristine despite the 6-hour operation he'd just completed. Behind him came the usual entourage, 3 residents, 2 surgical nurses, all of them riding the high of adrenaline and accomplishment. Sterling stopped when he saw her. His eyes swept over Nora the way a man might glance at a piece of furniture, present, functional, unremarkable. She kept mopping her head down the rhythmic swish-swish of the mop head, the only sound from her corner of the room. "You missed a spot." Sterling's voice carried the casual cruelty of someone who'd never been told no. He was 38, handsome in the way of men who'd been handsome their entire lives and expected the world to arrange itself accordingly. Yale undergrad, Johns Hopkins Medical, a father who owned half the pharmaceutical companies on the eastern seaboard. Nora looked up. Sterling pointed to a spot near the equipment cart. Then, without breaking eye contact, he peeled off his surgical gloves and dropped them on the floor, right where he'd pointed. The gloves hit the wet linoleum with a soft slap. "There," he said. "Now you didn't miss it." The nurses behind him giggled. Not loud, just enough. Sloane, the pretty one with the perfect highlights and a future that looked nothing like Nora's present, covered her mouth with one hand, but her eyes were smiling. Nora set the mop against the wall. She walked over, bent down. Her spine protested that familiar lightning bolt of pain shooting from her lower back to her hip. The screws and rods holding her together. Souvenirs from Kandahar, 2020. An IED that had killed 3 of her teammates and left her with a medical discharge and a pension that didn't quite cover rent in San Diego. She picked up the gloves with steady hands. Steady because she forced them to be. Steadiness was a choice, and she'd made harder choices in darker places. "Thank you, doctor," she said. Her voice was quiet, raspy, like gravel shifting under shallow water, the kind of voice that came from breathing too much dust and smoke and exhaust from burning vehicles. Sterling smiled. He'd won. Again. The same small victory he won every time they crossed paths, which was often because Grace Memorial wasn't large enough for both of them to exist without collision. He turned to leave, already forgetting her. The entourage followed. Their voices faded down the hallway, discussing technique, discussing the surgery, discussing weekend plans, and where to get the best brunch in San Diego. Nora stood there, holding the gloves, alone in the trauma bay with the fluorescent lights and the smell of disinfectant and the ghost of blood that no amount of mopping would ever fully erase. She didn't throw the gloves away immediately. She looked at them. Surgical gloves, size 7.5, latex. The left one had a small tear near the thumb where Sterling had been careless with a retractor. In another life, she would have written him up for that. Breach of sterile protocol. Risk of contamination. In another life, she would have done a lot of things, but that life was gone. Buried in the sand of Fallujah and the mountains of Kandahar, and the small, quiet cemetery where they'd laid her service dog to rest because he'd taken the shrapnel that was meant for her. Nora dropped the gloves in the biohazard bin. picked up her mop, kept cleaning. The night shift stretched ahead like a road with no exits. Morning came with the mechanical inevitability of hospital routines. Nora arrived at 6 a.m. for the shift change briefing. She sat in the back of the conference room, a disposable coffee cup warming her hands while the day shift trauma team filtered in. Doctors in pressed white coats, nurses in color-coded scrubs. Everyone young, everyone sharp, everyone moving with the confidence of people who belonged. She was in navy blue scrubs, the cheap ones from the hospital laundry service that never quite fit right, always a size too large, hanging off her frame like she was a child playing dress-up in adult clothes. Dr. Sterling swept in at 6:15 fashionably late, carrying a green smoothie and his phone. He took his place at the head of the conference table without acknowledging anyone scrolling through messages with the focus of a man whose attention was a valuable commodity. But Sloan noticed something. When Sterling set down his smoothie, his hand trembled. Just slightly, just enough that the cup rattled against the table for half a second before he steadied it. She'd seen that tremor before. In her uncle who'd come back from Iraq and couldn't hold a coffee mug without both hands. In the PA, who'd done 2 tours in Afghanistan and had to take beta blockers before procedures. Sterling caught her looking. His face hardened. The vulnerable moment vanished behind a wall of professional arrogance. "Something to say, nurse?" His voice was sharp. Sloan looked away. "No, doctor." But she filed it away. A crack in the armor. A hint that Dr. Marcus Sterling, Golden Boy of Grace Memorial, might not be as unshakable as he pretended. The shift supervisor, Margaret, started the briefing. Trauma Bay 1 needs restocking. Ultrasound machine in 3 acting up. Maintenance scheduled but not until Thursday. Equipment check on ventilators due by end of shift. She went through the list. Mundane. Critical. The infrastructure of saving lives rendered into checkboxes and schedules. Nora had done the equipment check at 4 a.m. during the dead hours when the trauma wing fell into its brief, uneasy silence. She'd found a problem with ventilator number 7. A pressure sensor reading inconsistent. Not broken. Just unreliable. The kind of thing that could turn critical in the wrong moment. She documented it, filled out the maintenance request, left it on Margaret's desk. Margaret reached that item on her clipboard. Ventilator 7 is flagged for maintenance. Priority, excuse me. Nora's voice cut through the room, quiet, respectful, but present. Every head turned. Sterling looked up from his phone with the expression of a man hearing furniture speak. The pressure sensor is reading .3 bar under spec. Nora continued. She didn't stand, didn't raise her voice, just stated fact. It's within tolerance now, but if you get a patient with ARDS or tension pneumothorax, that margin could mean the difference between viable and not. Silence. Margaret checked her notes. The maintenance request says next week. I'd recommend bumping it to today, Nora said. We can use ventilator 2 as primary for Bay 1 in the meantime. It's the newer model, better pressure control. Sterling set his phone down with exaggerated care. And you would recommend this? Why? His tone was pleasant, conversational. The way a professor might ask a student to explain an obviously wrong answer. Are you a respiratory therapist now? Did I miss a memo about nurses playing doctor? A few snickers. Bryce, the first-year resident with perfect teeth and a trust fund, shook his head slightly. His expression said everything. Typical. The old nurse overstepping. Again. Nora met Sterling's eyes. Gray eyes. The same gray as the ocean before a storm. Eyes that had watched men die and had decided who lived. Eyes that had learned in places where learning meant survival to read people completely. She saw Sterling clearly now, saw the insecurity hiding behind the arrogance, saw the hands that trembled when he thought no one was looking, saw someone who'd grown up with money and connections and had never once been tested by something he couldn't buy or charm his way out of. Except once, somewhere, in some moment that had broken something inside him that he kept carefully hidden. Just a suggestion, doctor, Nora said. She picked up her coffee, took a sip, let the moment pass. Sterling held her gaze for 3 seconds longer than necessary. Then he smiled, cold, satisfied. "Stick to your lane, Nurse Kincaid," he said, loud enough for the entire room to hear. Said it with the casual certainty of someone who'd never been wrong about anything that mattered. "Leave the medical decisions to people with medical degrees." Margaret cleared her throat, moved on. The briefing continued. Nora sat in the back and drank her coffee and felt the familiar weight of invisibility settle over her like a shroud. It wasn't new. She'd been invisible for 5 years now, ever since she'd traded her combat fatigues for scrubs, her rank for a name tag that said Nora Kincaid, RN. Nobody knew. Nobody knew that she'd spent 20 years as Lieutenant Nora Kincaid, Navy combat medic. Nobody knew her call sign had been Valkyrie. Nobody knew she'd performed emergency thoracotomies in the back of moving Humvees while taking small arms fire. Nobody knew she'd once held a Marine's heart in her bare hand and massaged it manually for 6 minutes until the medevac arrived. Nobody knew because she'd never told them, and they'd never asked. The morning passed in the routine chaos of a Level 1 trauma center. Nora restocked supplies, changed bedpans, ran labs to the pathology department, sanitized equipment. She moved through the trauma wing like a ghost present, but unseen, necessary, but unacknowledged. At 11:30, she was inventorying the code cart in Trauma Bay 2 when she heard voices approaching. Sterling. Again. He was doing rounds with a gaggle of medical students, showing off, pointing to equipment, and explaining its function with the enthusiasm of someone who loved the sound of his own voice. "This is an intra-aortic balloon pump," Sterling said, gesturing to the machine like a game show host revealing a prize. "We use it for cardiogenic shock. The balloon inflates during diastole, improving coronary perfusion." Nora glanced over, kept working. She was counting epinephrine vials, making sure the cart was fully stocked. One of the students, a young woman with earnest eyes and a new white coat, still creased from the package, raised her hand. "Dr. Sterling, what's the contraindication profile?" "When wouldn't you use it?" Sterling launched into an explanation. Aortic dissection, aortic regurgitation, severe peripheral vascular disease. He missed one. Nora knew he missed one because she'd seen a surgeon in Ramadi kill a patient by inflating a balloon pump in someone with an undiagnosed abdominal aortic aneurysm. The pump had ruptured the aneurysm. The soldier had bled out in 90 seconds. She'd been the one doing chest compressions when he died. She'd been the one who had to tell his team. She should say something. She looked at Sterling, at the students hanging on his every word, at the way he stood with his hands in his coat pockets, rocking slightly on his heels, the posture of absolute confidence, masking whatever shadows lived behind his eyes. She said nothing. What would be the point? He'd dismiss her. The students would learn to dismiss her too. And someday, maybe one of them would make the mistake Sterling had just taught them to make, and someone would pay the price. But that wasn't her responsibility anymore. She'd given 20 years to teaching people how to save lives. She'd earned her silence. Nora finished the inventory, signed off on the cart, moved to the next task. Behind her, Sterling's voice droned on, confident and incomplete. The call came at 1:47 p.m. The hospital's public address system crackled to life with 3 sharp tones. Emergency alert. Then a voice crisp and urgent. Code Black, Trauma Bay 1, ETA 2 minutes, multiple casualties, mass casualty event reported, all available personnel to Trauma 1, Code Black. The announcement repeated twice. Code Black, the worst kind. Multiple critical patients, limited resources, triage decisions where someone would have to choose who lived and who waited, and who got only comfort care in their final moments. Nora was in the supply closet when she heard it. She abandoned the inventory sheet and ran. Her bad hip screamed. She ignored it, pushed through the pain with the muscle memory of someone who'd learned long ago that pain was just information, not instruction. The trauma wing exploded into controlled chaos, doctors sprinting from all directions, nurses grabbing crash carts. The charge nurse already on the phone with the blood bank calling for O-negative units, lots of them. The surgical team being paged overhead. Anesthesia, radiology, everyone. Nora reached Trauma Bay 1 just as the automatic doors hissed open and the first ambulance crew burst through. 2 paramedics, young, scared. One of them was doing chest compressions on the stretcher as they rolled, counting under his breath, sweat pouring down his face despite the cool air conditioning. 19-year-old male, the lead paramedic shouted, his voice cracking with the strain of information delivered at speed. Motor vehicle accident, T-boned at highway speeds, prolonged extrication, GCS-3 at scene dropped to 0 in transit, BP 60 over 30 and falling. We've lost pulses twice in the rig. They slammed the stretcher into the trauma bay. Doctor. Sterling was already there, gloved and gowned, his game face on. The students and residents scattered to their positions. Sloan, the pretty nurse, took her place at the medication cart. Bryce, the intern, moved to help transfer the patient to the trauma table. Nora stood at the back of the room, waiting. She wasn't assigned to Trauma Bay 1. She was cleaning crew, restocking, supporting staff. She stayed anyway. The patient was young, blonde hair matted with blood. His face was swollen purple with contusions distorted by trauma. His chest was bare, covered in EKG leads and defibrillator pads. His breathing was labored wet, the sound of fluid where air should be, but it was his abdomen that caught Nora's attention. Distended, tight, the skin stretched and discolored a deep purple-black, spreading from his right side like a bruise blooming under pressure. She knew that pattern, had seen it 100 times in places where IEDs turned vehicles into coffins and young men into anatomy lessons, had seen it in Fallujah when a supply convoy hit a roadside bomb, had seen it in Kandahar when a Humvee rolled over a pressure plate, blunt force trauma to the liver, grade 4, maybe grade 5. Massive internal hemorrhage, blood pooling in the peritoneal cavity with nowhere to go. Sterling was focused on the chest, shouting orders. Bag him harder, get me portable X-ray. I need to see what we're dealing with. Cross-match for 6 units. Someone get a central line in. Move people. The room moved. Everyone had a job. Everyone was working. Except Sterling was looking at the wrong thing. Nora watched through the glass partition, her hands pressed against the cool surface. Her heart rate was 65. Steady. The same steady it had been when she'd performed a needle decompression on a convoy commander while her vehicle was being torn apart by machine gun fire. On the table, the young man's blood pressure continued to fall. 50 over 28, 45 over 20. The monitor alarm began its insistent wail. He's crashing, Sloan said. Her voice was tight, controlled, but Nora heard the fear underneath. The sound of someone who'd never seen a person die this fast and was watching it happen. Sterling stared at the monitor like it had personally offended him. It's the chest. Has to be. Hemothorax or cardiac tamponade. Get me an ultrasound. Fast exam. Now. Bryce wheeled the ultrasound machine over. Sterling grabbed the probe-squirted gel on the patient's chest with hands that weren't quite as steady as they should have been, began scanning. Nora knew what he'd find. Nothing, because the problem wasn't in the chest. The monitor showed a BP of 40 over 15. Losing him, Bryce said. His voice had climbed half an octave, panic creeping in. Paddles, Sterling snapped. Charging to 200. Nora's jaw clenched. They were going to shock him. Shock a heart that was pumping fine but had nothing to pump because all the blood was in the belly. She saw it play out in her mind. The shock. The brief spike in cardiac activity. The continued drop in pressure because the fundamental problem wasn't the heart. It was the hemorrhage they couldn't see. And then exsanguination. The kid would bleed out internally while they shocked his heart over and over, wondering why the textbook solution wasn't working. 4 minutes to death. Maybe less. Nora looked around. No one else saw it. They were all focused on Sterling, waiting for his orders, trusting his judgment, because he was the doctor and they were the supporting cast. She could stay quiet, could let it play out, could preserve the invisible peace she'd built for herself over 5 years of silence. Or she could break it. The monitor hit 35/10. Clear! Sterling raised the paddles. The high-pitched whine of the charge filled the room. Nora's hand hit the door release. She didn't decide to move. Her body decided for her. 20 years of training overrode 5 years of silence in a single heartbeat. She pushed through the door, crossed the trauma bay in 4 strides. Her voice cut through the chaos like a blade through silk. Stop! Every head turned. Sterling looked at her with an expression of pure incredulity. The paddles were still raised, charged, ready. 200 joules of electricity waiting to deliver a shock that would accomplish nothing. "What the hell are you doing?" he said. "Get out. This is a sterile—" "It's not cardiac," Nora said. Her voice was calm, flat, the voice she'd used to call in medevac coordinates under fire. No emotion, just fact. "He has a grade 5 liver laceration. You're pumping blood into his peritoneal cavity. You shock him, now you'll coat him permanently." The room went silent except for the monitor alarm, a flat, insistent tone that marked the seconds between life and death. Sterling's face flushed red. "Security? Get this woman out of—" "Look at his abdomen," Nora interrupted. She pointed, not at the patient. At the ultrasound screen Sterling was still holding. "Do a fast exam on the RUQ, right upper quadrant. You'll see free fluid, massive hemorrhage." "I don't take orders from nurses," Sterling said, but his eyes flicked to the screen, then to the patient's abdomen. Even through his anger, through his ego, he could see what she was pointing at. The distension was visible now, growing, the belly expanding with each second as blood filled the cavity. Sloane saw it too. "Doctor, she might be right." "She's not right," Sterling said, but his voice had lost its edge. Uncertainty crept in like water through a crack. He moved the ultrasound probe down, placed it on the right upper quadrant just below the ribs. The screen filled with black, free fluid, liters of it. The liver, barely visible through the blood, was torn nearly in half. Sterling's face went white. "Jesus," Bryce whispered. Nora didn't wait for permission. She grabbed the phone on the wall, punched the code for the OR. "This is Trauma Bay 1. I need a surgical suite open immediately. Damage control, laparotomy. Patient is a 19-year-old male with grade 5 liver lac and massive hemoperitoneum. He needs to be in the OR in the next 90 seconds, or he dies." She hung up, turned to Sterling. "You need to do a damage control lap," she said. Quiet, not gloating, not triumphant, just stating fact. "Pack the liver. Get proximate control of the hemorrhage. He's too unstable for definitive repair. Pack it close him, let him stabilize, take him back in 12 hours. Sterling stared at her, then at the monitor. BP 30/8. He made the decision. "Move," he barked. "Get him to OR3, now. Sloane, call the blood bank. I need 10 units waiting when we get there. Bryce, you're with me. Let's go." The room exploded into motion. The stretcher was already moving. Sterling jogging alongside it, calling orders, his earlier anger replaced by the focused intensity of a surgeon who'd just realized how close he'd come to killing a patient. Nora stepped back. Let them pass. Watch them disappear through the doors toward the surgical wing. And then she stood there, alone in the empty trauma bay. Blood on the floor, equipment scattered, the monitor still beeping its alarm for a patient who was no longer there. Her hands were shaking now, not a lot, just the familiar tremor, the vibration that lived in her bones and never quite went away, the echo of Black Hawk rotors and mortar impacts, and the sound of men screaming for their mothers in languages she didn't speak. She'd broken cover, stepped out of the shadows, made herself visible, and she knew with the certainty of someone who'd seen how institutions protected themselves that there would be consequences. The consequences came at 3:15 p.m., Nora was in the staff locker room changing out of her scrubs when Margaret appeared in the doorway. Her face was carefully neutral, the face of someone delivering bad news professionally. "Administrator wants to see you," Margaret said. "Now." Nora nodded, pulled on her civilian clothes, jeans that had seen better years, a plain gray sweatshirt, shoes with worn-down heels. She followed Margaret through the hospital corridors to the administrative wing, a different world. Carpet instead of linoleum, art on the walls instead of hazard signs, the smell of coffee instead of disinfectant. They stopped at a door marked Leonard Hartwell Hospital Administrator. Margaret knocked. A voice from inside said, "Come in." Nora entered. The office was large, mahogany desk, leather chairs. A window overlooking the parking lot, where her old Toyota waited like a faithful dog. Mr. Hartwell sat behind the desk, 50-something gray hair, expensive suit. He had the look of a man who'd spent his career managing budgets and liability rather than patience. Dr. Sterling stood beside the desk, arms crossed, face set in righteous anger. "Ms. Kincaid," Hartwell said. He didn't invite her to sit. "Dr. Sterling has filed a formal complaint regarding your conduct in Trauma Bay 1 this afternoon." Nora said nothing, just stood there, waiting. Sterling stepped forward. "You physically interfered with a medical procedure. You countermanded my orders in front of my staff. You made diagnostic calls that are completely outside your scope of practice as a registered nurse." He pulled out a folder, laid it on Hartwell's desk with the careful precision of someone who'd been planning this moment. "Insubordination, practicing medicine without a license, compromising the sterile field, creating a hostile work environment. This is grounds for immediate termination." Hartwell looked at Nora. "Do you have anything to say?" Nora thought about it. Thought about explaining that she'd saved the kid's life. That Sterling had been about to shock a patient whose only problem was that he'd run out of blood to pump. That the liver lac was visible to anyone who'd spent time in a combat zone and knew what massive internal hemorrhage looked like. She thought about pulling out her military record, explaining her credentials. Tactical combat casualty care instructor, advanced trauma life support. 20 years of experience that made Sterling's 8 years look like a summer internship. She thought about fighting, and then she realized she was tired. Tired of being invisible, tired of being dismissed, tired of watching incompetence parade as confidence while she scrubbed floors and kept silent. "No," Nora said. "I have nothing to say." Hartwell nodded, like he'd expected this, like this was a script they'd all read before. He pulled a form from his desk drawer, a pink slip, pre-printed. Just needed a signature. "Effective immediately, your employment with Grace Memorial Hospital is terminated. You'll receive 2 weeks severance pay. Your final check will be mailed to your address on file. Please surrender your badge and any hospital property before you leave the building." Nora unclipped her badge from her belt, set it on the desk. The plastic clicked against the wood, a sound like a door closing. She didn't look at Sterling, didn't give him the satisfaction. "That's it?" Hartwell asked. "No argument, no defense." Nora almost smiled. Almost. "Would it matter?" she asked. Hartwell's silence was answer enough. Nora turned and walked out, down the carpeted hallway, past the art and the coffee smell and the comfortable fiction that hospitals were run by people who cared about anything other than liability and optics. Her locker was still open. She grabbed her few belongings, a spare stethoscope she'd bought with her own money, an extra pair of socks, a photograph in a cheap frame. The photograph showed a German shepherd. His name had been Ranger. He'd died 5 years ago, taking shrapnel meant for her when their convoy hit an IED outside Kandahar. The surgeons had saved her, given her a spine full of titanium and a medical discharge and a VA pension that didn't quite cover rent in San Diego. But they couldn't save Ranger. Nora put the photo in her cardboard box, closed the locker. The metal door clanged shut with a finality that felt appropriate. She walked out through the staff entrance. The sky was overcast, gray clouds rolling in from the Pacific, rain coming. She could feel it in her back, in the screws and rods and pins that held her spine together. Her own personal weather station, a souvenir that kept on giving. Her car was a 2007 Toyota Camry, faded blue. 187,000 miles. It started on the third try like always. Nora sat behind the wheel, put her hands at 10 and 2, stared through the windshield at the hospital building. 5 years of her life. 5 years of silence and invisibility and night shifts that asked nothing and gave nothing. Somewhere in there in OR 3. Sterling was probably saving that kid's life. Following the exact procedure she'd told him to follow. Packing the liver, getting control, stabilizing the patient. He'd take credit for it. Of course he would. The brilliant young surgeon who diagnosed the liver lac and made the critical call. And maybe that was fine. Maybe it didn't matter who got credit as long as the kid lived. Nora turned the key. The engine caught. She put the car in drive. And then the rain started. Not a drizzle, a downpour. The kind that came in off the Pacific and turned San Diego into a gray watercolor. Rain hammered the windshield. The wipers beat a rhythm. Back and forth, back and forth. Nora sat there, engine idling, rain turning the world into a blur. 5 years of silence. 5 years of being invisible. 5 years of pretending she was just a nurse who scrubbed floors and kept her head down. And for what? She put the car in park. Turned off the engine. Let the rain wash over the car like the world was trying to clean something that couldn't be cleaned. This was the low point. This was the moment where the weight of everything pressed down and she had to decide. Stay invisible or be seen. The rain kept falling. Nora closed her eyes and waited for whatever came next. Inside Grace Memorial Hospital, 3 floors above the parking lot where Nora sat in the rain, the trauma wing had settled into an uneasy quiet. Bryce stood at the nurse's station, his tablet forgotten in his hand. He'd been charting the liver lac patient's pre-op vitals when the first sound reached him. A sound, faint, distant, like thunder, but wrong, mechanical. "You hear that?" Sloan asked. She'd been restocking a medication cart, but her hands had stopped moving. Her head tilted slightly, listening. "Hear what?" Bryce said. Then he heard it too, a low thrumming. It wasn't coming from any piece of hospital equipment. It was coming from outside, from the sky, growing steadily louder with each passing second. The sound built, not like an ambulance siren that peaked and faded. This was continuous, persistent, a deep bass vibration that you felt in your chest before you heard it in your ears. The floor trembled, just slightly, just enough that Bryce looked down confused, wondering if it was an earthquake. "What is that?" Sloan whispered. Bryce moved to the window. His reflection stared back at him from the glass, pale and uncertain. But beyond the reflection, beyond the parking lot where rain was falling in sheets, the sky had darkened. Not with storm clouds, with something else. The rhythmic beating grew deafening. Thump, 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 thump. Windows rattled in their frames. The fluorescent lights flickered. In the parking lot below, car alarms started wailing in sequence, triggered by the sound waves. Headlights flashed, horns blared, a symphony of automotive panic. "Jesus Christ," Bryce said. And then he saw it. The helicopter dropped below his sight line, massive and black and impossibly loud. It wasn't landing on the roof like a normal medevac. It was landing on the front lawn right beside the main entrance. Grass and debris exploded outward in a perfect circle as the rotor wash hit the ground. Rain turned into horizontal needles. The helicopter's skids touched grass with a thud that Bryce felt through the building. The rhythmic beating became a deafening roar that made conversation impossible. Every person in the trauma wing stopped. Doctors mid-stride, nurses mid-sentence, patients in wheelchairs. Everyone turned toward the windows, toward the sound of military force descending on a civilian hospital in the middle of a Tuesday afternoon. The intercom crackled. A security guard's voice, shaking with adrenaline and confusion. "All personnel, we have an situation at the main entrance. Unknown military. I don't know. Just everyone stay calm. But nobody moved. They just stared. Bryce watched the men jump from the helicopter before the rotors had even begun to slow. 6 of them, combat fatigues, Navy insignia, sidearms strapped to their thighs. They moved with the coordinated precision of operators who'd done this 1,000 times, hitting the ground in pairs, spreading out, securing a perimeter. The last man out was different. Taller, broader, older. He had a face carved from granite and a scar that ran from his left temple down to his jaw, the kind of scar that came from something sharp and violent and barely survived. Commander rank insignia on his collar. That man didn't wait for his team. He was already sprinting toward the hospital entrance, ignoring the rain, ignoring the security guards who were stumbling out of the building with confused expressions and hands reaching for radios they didn't know whether to use. "What the hell is happening?" Sloan breathed. The lobby doors below exploded open. The main entrance of Grace Memorial had a security checkpoint, 1 metal detector, 2 guards, both retired cops working their pension years in a job that usually meant checking visitor badges and helping elderly patients find the cardiology wing. They were not prepared for Commander James Stone. Stone hit the lobby at a dead run. His boots tracked mud and grass across the polished floor. Water streamed from his uniform. His face was set in an expression that made grown men step aside without thinking, without questioning, without doing anything but getting out of the way. The first security guard put up a hand. "Sir, you can't just—" Stone didn't slow down. "Out of the way." His voice wasn't loud, didn't need to be. It carried the weight of absolute authority, the kind of authority that came from ordering men into gunfire and having them obey without question, the kind that separated officers from everyone else. The guard stepped aside. Stone scanned the lobby. His eyes swept across faces with the systematic thoroughness of someone trained in threat assessment. Visitors sitting in plastic chairs, a woman at the information desk with her mouth hanging open, nurses in the hallway beyond frozen mid-step. Behind Stone, his team filed through the entrance. Water dripped from their uniforms, pooling on the floor. They formed a loose perimeter, hands near their weapons, but not on them. Not yet. Professional. Controlled, but ready. The lobby had gone absolutely silent except for the faint sound of CNN playing on a wall-mounted TV that nobody was watching. Stone took 3 steps into the center of the lobby, planted his feet. When he spoke, his voice could have cut through steel. "I need Valkyrie." The word echoed off the marble floors and high ceilings, bounced back, hung in the air like a challenge. Nobody moved. Nobody spoke. Stone's eyes narrowed. His jaw worked. "Valkyrie, where is Lieutenant Nora Kincaid?" More silence. Confused faces. People looking at each other, searching for answers that none of them had. From the hallway, Bryce appeared. He'd run down from the trauma wing, still wearing his white coat, his tablet clutched to his chest like a shield. Sloan was right behind him, her perfect hair disheveled from the sprint. "Valkyrie," Bryce repeated. His voice cracked slightly. "I don't— What?" Stone turned to face him. The commander was 45, but he looked older. Hard miles. Combat miles, the kind of aging that came from making life-and-death decisions until they wore grooves into your face. "Lieutenant Nora Kincaid," Stone repeated, slower, each word enunciated with the precision of someone who would not repeat himself a 3rd time. "Former Navy combat medic. I know she works here. I need her. Now." Sloan's face went pale. "You mean the janitor nurse?" The words hung in the air. Stone's expression didn't change, but something shifted behind his eyes. A dangerous stillness, the kind that preceded violence in men who knew how to deliver it efficiently. "The who?" His voice had dropped an octave, quiet now, the kind of quiet that made smart people reconsider their life choices. Sloan took a step back. The older nurse. She works nights, cleaning, restocking. She doesn't, she trailed off, because the look on Stone's face told her that whatever she was about to say was very, very wrong. Footsteps from the administrative wing. Mr. Hartwell appeared, straightening his tie, putting on his professional face, the face that dealt with donors and board members and Joint Commission inspectors, the face that had never dealt with Navy commanders who looked like they were one bad answer away from declaring martial law. "Gentlemen," Hartwell said, smooth, diplomatic. "I'm Leonard Hartwell, Hospital Administrator. I'm sure we can resolve whatever misunderstanding." "Where is Lieutenant Nora Kincaid?" Stone interrupted. Not a question, a demand. Hartwell blinked, looked confused. Then recognition dawned slowly like sunrise over a landscape he'd never bothered to look at carefully. "Oh, you mean Nurse Kincaid? Yes, well, I'm afraid she's no longer employed by this hospital. She was terminated approximately—" He checked his watch with the careful precision of a man who documented everything. 10 minutes ago. The lobby went silent again. But this time the silence had weight, had texture, had the quality of something about to break. Stone stared at Hartwell. Seconds passed. 5. 10. The commander's jaw worked like he was physically preventing himself from saying something that would end careers and possibly lives. Finally, Stone pulled a radio from his belt, keyed the mic. His voice was controlled, professional. But underneath, there was something cold and furious. "Bird 2, I need you airborne. Target is a blue Toyota Camry, California plates. Last seen in the staff parking lot approximately 10 minutes ago. Driver is a white female, 52, brown hair, 5'7". Find her. Do not let her leave the area." He released the mic, turned back to Hartwell. "You fired Valkyrie." Not a question. A statement of fact that Stone was still trying to process, still trying to believe. "I'm sorry, who is Valkyrie?" Hartwell asked, genuinely confused now. Behind Stone, one of his team members, a massive man with a beard and knuckles like walnuts, made a sound that might have been a laugh or a curse. It was hard to tell which. Stone ignored him, kept his eyes on Hartwell. "When did you fire her?" "I told you, about 10 minutes. Why?" Hartwell straightened, drew himself up. He had authority here. This was his hospital, his domain. "That's confidential personnel information. I'm not at liberty to discuss." "Try again." Stone took a step forward, just one, but the temperature in the lobby seemed to drop 10 degrees. From behind Hartwell, another voice, smug, self-satisfied. The voice of someone who'd won and wanted everyone to know it. "She interfered with a medical procedure." Dr. Sterling stepped out of the administrative hallway. He'd changed out of his surgical scrubs, back in his white coat, looking every inch the competent, confident physician. But Sloan noticed his hands, tucked into his pockets, hiding something. "She practiced medicine without a license," Sterling continued. "She compromised patient care. She created a dangerous situation. I filed a formal complaint. The administrator made the right call." Stone turned his full attention to Sterling, looked him up and down with the clinical assessment of someone evaluating a potential threat and finding it wanting. "You're the trauma surgeon?" Stone asked. "I'm the chief of trauma surgery, yes." Sterling crossed his arms. Defensive posture dressed up his confidence, but his voice was steady, his face composed. Stone was quiet for a moment. Then, "How's the kid doing the liver lac from the MVA?" Sterling blinked. "How did you—" "Answer the question, doctor." "He's stable. In the ICU. I performed a damage control laparotomy, packed the liver. He'll need a second surgery in 12 hours, but he should survive." Sterling's voice had the tone of someone reciting an accomplishment, expecting praise. "Who diagnosed the liver injury?" Stone asked. Silence. Sterling's jaw tightened. "I did. Based on the FAST exam and clinical presentation, wrong." Stone pulled a phone from his pocket, tapped the screen with movements that were almost casual, turned it around. On the screen was security footage, grainy, black and white, time-stamped from 90 minutes earlier. It showed Trauma Bay 1 from the ceiling camera, showed Sterling with the defibrillator paddles raised, showed a woman in scrubs bursting through the door, showed her pointing at the ultrasound, showed Sterling's face when he moved the probe and saw the free fluid, showed the exact moment his certainty crumbled. That, Stone said, his voice flat and precise, is Lieutenant Nora Kincaid telling you that you were about to kill a patient, and that, he tapped the screen again, forwarding to Sterling following Nora's instructions, is you doing exactly what she told you to do because she saved that kid's life, not you. Sterling's face flushed red. That footage is hospital property. You have no right to access. Stone's radio crackled. A voice came through, young and urgent. Commander, we have the vehicle. Blue Camry stopped in the staff parking lot. Driver still inside. Pilot is moving to intercept. Stone keyed the mic. Block her in. Do not let her leave. I'm en route. He looked at one of his operators. Mackenzie, you're with me. Rest of you secure this location. Nobody leaves until I get back. The operator nodded. He and Stone headed for the exit. Hartwell found his voice. It shook. Wait. You can't just... This is a hospital. You can't commandeer our staff. There are regulations, protocols, legal procedures. Stone stopped at the door, didn't turn around. His voice when it came was tired, like a man explaining something obvious to someone who should know better. Mr. Hartwell, that patient in your ICU. His name is Ethan Crawford. He's 19 years old. He's also the only son of Senator Richard Crawford, California. The senator is currently on a flight from Washington, D.C. He will be landing at Lindbergh Field in 75 minutes. Stone let that sink in. Let Hartwell's face go from red to white. The senator's son is going to need a very specific procedure in the next few hours. A procedure called REBOA, resuscitative endovascular balloon occlusion of the aorta. It's used to control massive hemorrhage when conventional surgery isn't enough. There are exactly 12 people in the continental United States qualified to perform it. He paused, looked directly at Sterling. Are you one of them, Doctor? Sterling opened his mouth, closed it. His hands came out of his pockets. They were trembling. I've done balloon catheter procedures. That's not what I asked. Have you performed a REBOA procedure specifically? Have you threaded a balloon catheter through the femoral artery, advanced it to the descending aorta, and inflated it to achieve zone 1 occlusion in a hemorrhaging patient? No, but then step aside. Stone turned to his team. Let's move. He pushed through the doors. The rain had slowed to a drizzle. The helicopter's rotors were still spinning, just barely ready to lift off at a moment's notice. Behind him, Hartwell stood frozen. His face had gone pale. Sweat beaded on his forehead despite the air conditioning. Sterling looked like he wanted to say something, to argue, to defend himself. But for the first time in his career, Dr. Marcus Sterling had absolutely nothing to say. Sloan whispered to Bryce, "Who is she?" Bryce was already pulling out his phone. Fingers flying across the screen searching. Nora Kincaid, Navy, combat medic. The search results loaded. His eyes went wide. Nora sat in her car, hands on the steering wheel, watching the rain slow from a downpour to a drizzle. She should leave, should start the engine and drive away and let whatever this chapter of her life had been fade into the rearview mirror. Find another hospital, another night shift, another 5 years of invisible silence. But she didn't move. Because something was happening. She could feel it. The same instinct that had kept her alive in Fallujah and Kandahar and a dozen other places where the wrong decision meant body bags. The instinct that said, wait, pay attention, something's coming. The sound reached her before she saw anything. A helicopter, different from the big MH-60 that must have landed somewhere nearby. This was smaller, higher pitched. The distinctive whine of a little bird, the kind they used for fast insertions and extractions in urban environments. Nora's heart rate kicked up, not panic, just recognition. The body remembering what the mind had tried to forget. The little bird descended vertically through the rain, dropping into the parking lot 20 feet in front of her car. The skids touched asphalt with barely a sound. Precision flying, the kind that required thousands of hours and nerves of steel. 2 men jumped out. Same fatigues as before, same purpose. One of them jogged to Nora's driver's side window, knocked, polite but insistent. Nora rolled down the window. Rain blew in. The rotor wash, even diminished, whipped her hair around her face. The operator was young, maybe 25. He had kind eyes behind tactical glasses. When he spoke, he had to raise his voice over the helicopter noise. "Ma'am, Commander Stone needs you. Immediately." Nora looked at him, then at the helicopter, then at the growing crowd of hospital staff gathering at the windows, phones out, filming, capturing this moment for social media and local news and whatever viral phenomenon this was about to become. "I don't work at the hospital anymore," she said. "I know, ma'am. The commander is aware. This isn't about your employment status. This is about a patient who needs you. Senator's son, critical condition. You're the only one in San Diego who can help him." Nora's hands were on the steering wheel. She could see them clearly now in the gray afternoon light. The scars on her knuckles, the small burns from hot brass casings, the calluses from carrying litters and gripping weapons and doing chest compressions on men who were already dead. "But you tried anyway, because you always tried." "I'm not military anymore," she said. "I'm not on active duty. I can't be ordered to—" "Ma'am." The operator's voice was gentle but firm. "With respect, this is not an order. We're asking. We have a 19-year-old kid dying in that hospital. Commander Stone says you're the only person who can save him. So please, come with us." Nora looked at her hands again, at the photograph of Ranger on the dashboard, at the reflection of herself in the rearview mirror, a 52-year-old woman in wet civilian clothes sitting in a parking lot being asked to be something she'd tried very hard to stop being. What would Ranger do? Stupid question. Ranger would have been out of the car already. Nora turned off the engine, grabbed her bag, opened the door. The rain hit her immediately, soaked through her sweatshirt, plastered her hair to her skull. She looked exactly like what she was, a middle-aged woman confused about how her quiet life had exploded into military helicopters and senator's sons in the span of 30 minutes. The operator smiled. "Thank you, ma'am. This way." He guided her to the little bird, helped her into the jump seat. The second operator was already back in position. The pilot gave a thumbs up. Nora barely had time to buckle in before they were lifting off. The little bird climbed fast. The parking lot fell away below them. She could see her Toyota down there, door still open, looking abandoned. Could see the crowd of people pointing up. Could see the larger MH-60 on the front lawn. And ahead, visible through the rain, was Grace Memorial Hospital. They were bringing her back, whether she was ready or not. The little bird touched down on the hospital's front lawn 30 seconds later, parking right next to the larger helicopter. Stone was waiting. He stood in the rain, arms crossed, watching the bird land. When Nora climbed out, he stepped forward. For a moment, they just looked at each other. Stone was older than she remembered. The last time she'd seen him, he'd been a lieutenant, 23 years old, leading a SEAL team in Ramadi 2007. She'd patched up 3 of his men after an IED strike, worked on them in the back of a moving Humvee while taking sporadic small arms fire. 2 had lived. 1 hadn't. The one who hadn't lived had been Stone's best friend, a kid from Texas named Martinez who'd bled out despite everything Nora had tried. Stone had never forgotten, had never blamed her, had spent the last 18 years looking for her to say thank you for trying. And now he'd found her. "Lieutenant Kincaid," he said. His voice was formal, respectful. The way senior officers addressed each other even when one of them wasn't wearing a uniform anymore. "I'm not a lieutenant anymore," Nora said. "I'm retired." "Retired," Stone repeated. He looked her up and down, took in the civilian clothes, the wet hair, the way she stood weight-balanced despite the obvious pain in her hip. "Is that what you're calling it?" "It's what it is." "Then why are you here?" Nora didn't have an answer for that. Stone nodded, like he'd expected the silence. "Come on, we need to talk, and you need to see the patient." He turned and walked toward the hospital entrance. Nora followed. The operators fell in around them, a protective formation that was probably unconscious at this point. Muscle memory from too many hostile zones. Inside the lobby, the crowd had grown. More staff, more visitors, all of them watching, whispering, phones out, recording. Hartwell stepped forward. His professional face was back on, but it was cracking at the edges like old paint. "Commander Stone, I'm sure we can discuss this in a more appropriate venue. Perhaps my office?" "Conference room," Stone said, not to Hartwell, to one of his men. "Clear it. I need 15 minutes. No interruptions." The operator nodded and moved off. Stone looked at Hartwell. "You're going to want to be there for this conversation, Mr. Hartwell. You too, Dr. Sterling." Sterling had been standing in the background trying to look calm and failing. At the sound of his name, he stepped forward. "I don't see why I need to, because in about 10 minutes, I'm going to explain to you exactly who Nora Kincaid is. And when I'm done, you're going to realize that firing her was the single biggest mistake of your professional life." Stone's smile was cold. "So yes, you definitely want to be there." He turned and walked down the hallway. Nora followed. Behind them came Hartwell Sterling and what seemed like half the hospital's staff. They reached a conference room. The operator had cleared it, moved the scheduled meeting elsewhere. Stone entered first, pulled out a chair at the head of the table. "Lieutenant," he said, gesturing to the chair. Nora didn't sit, just stood there dripping rainwater on the carpet, arms crossed. Stone sighed, pulled out a laptop from his bag, set it on the table, opened it. The screen glowed to life. He typed in a password, then another. Military-grade security protocols. The screen filled with text. Official documents, military service records, classified clearances slowly being declassified for this specific moment. Stone turned the laptop around so everyone could see. "This," he said, his voice taking on the formal tone of an official briefing, "is Lieutenant Nora Kincaid's military service record, recently declassified at my request and with approval from Naval Special Warfare Command for the purposes of this briefing." He clicked to the first page. A photograph appeared. Nora 20 years younger in combat fatigues, dirt on her face, blood on her hands and uniform, standing next to a helicopter in what looked like a desert. Her eyes, even in the photo, had that 1,000-yard stare, the look of someone who'd seen too much and would never unsee it. Lieutenant Kincaid served in the United States Navy from 2001 to 2021, 20 years. She completed Navy combat medic training at the top of her class, advanced trauma life support, tactical combat casualty care. She became one of the first women to complete the Special Operations Combat Medic course, a program with an 80% attrition rate. Stone clicked to the next page. Deployment records, a long list that scrolled off the screen. 8 combat deployments: Iraq, Afghanistan, Syria. Attached to SEAL teams, Marine Force, Recon, and Army Special Forces. She operated in some of the most dangerous areas of operation in modern military history. He clicked again. A statistic filled the screen. 412 documented combat saves, meaning 412 men and women are alive today, walking around having families, living lives because of her. The room was silent except for the hum of the laptop's fan. Stone clicked to the next page. Medals and commendations filled the screen in a long list. Silver Star for Valor, Bronze Star with V device for Valor, 3 Navy Commendation Medals, Purple Heart, twice, Combat Action Ribbon, and this one, he pointed to a specific medal. The image showed a Bronze Cross, the Navy Cross, the second highest military decoration for valor in the United States, one step below the Medal of Honor. He let that sink in, watched the faces around the table, watched understanding dawn slowly like a sunrise over people who'd been living in the dark. Lieutenant Kincaid received the Navy Cross for single-handedly treating and evacuating 14 wounded Marines while under sustained enemy fire in Helmand Province, Afghanistan. She was shot twice during the evacuation. Here and here. Stone pointed to his left shoulder, then his thigh. She kept working, saved all 14 men, then collapsed from blood loss after the last Marine was loaded on the medevac. Stone clicked to another page. This one showed medical certifications, a list longer than most doctors accumulated in entire careers. She's certified in every advanced trauma protocol in military medicine. She's taught tactical combat casualty care to over 300 special operations personnel. She's performed procedures in the field that most civilian doctors won't attempt in a fully equipped OR. Stone looked directly at Sterling. The surgeon had gone pale. His hands, no longer hidden in his pockets, trembled visibly against the conference table. "That woman you called a janitor?" Stone's voice was quiet now. "Dangerous. That woman you fired, she saved more lives in a single deployment than you will in your entire career. And she did it in places where making a mistake meant dying." He clicked to another photo. This one showed a younger Stone being carried by a female medic. Blood everywhere, a burning vehicle in the background. "Ramadi 2007. My SEAL team hit an IED. 3 men down, including me. I had arterial bleeding from my femoral. Martinez had a sucking chest wound. Johnson had a traumatic amputation below the knee. We were taking fire from 2 positions." Stone's voice had gone flat, the voice of someone recounting trauma that had never healed. "Lieutenant Kincaid fast-roped down from the medevac bird while we were still in the kill zone. She dragged me to cover, clamped my femoral, did a needle decompression on Martinez, tourniqueted Johnson, all while rounds were impacting around her, all while her pilot was screaming at her to abort because the LZ was too hot." He clicked to the next photo. A funeral. Marines in dress blues. A flag-draped coffin. "Martinez didn't make it. Died 30 seconds after we loaded him on the bird, but Johnson and I lived. Because of her." Stone looked at Nora. His eyes were wet. "I've been looking for you for 18 years, Lieutenant, trying to say thank you. You disappeared after your discharge. Changed your name on civilian paperwork to avoid attention. I finally found you 3 months ago. Been keeping tabs ever since, waiting for the right time to reach out." He turned back to the room, to Hartwell, to Sterling. "And I find out she's been here, at this hospital, for 5 years, scrubbing floors, being called a janitor, being mocked and dismissed by people who aren't fit to carry her medical bag." Stone closed the laptop. The screen went dark. "So, yes, Mr. Hartwell. Yes, Dr. Sterling. You fired Valkyrie. You fired one of the most decorated combat medics in naval history. You fired the woman who saved my life and the lives of countless others." He looked at Nora. "And now we need her, because that kid upstairs is going to die without her." The room was silent. Nora stood there, arms still crossed, face unreadable, but inside something was breaking open. 5 years of silence. 5 years of hiding. 5 years of pretending she was nobody. And in one briefing, Stone had torn all of that away. She felt exposed, vulnerable, seen, and for the first time in 5 years, she felt like Valkyrie again. The ICU on the 4th floor of Grace Memorial was designed for death to be temporary. The space held 12 beds separated by curtains and medical equipment that beeped and hummed with the steady rhythm of mechanical life. The lighting was dimmed easier on patients hovering between consciousness and oblivion. The air smelled of antiseptic and recirculated oxygen and the particular chemical sweetness of IV medications keeping people tethered to this world. Nora entered, still wearing her wet civilian clothes. A nurse at the station looked up, started to say something about visitor protocols, then saw Commander Stone behind Nora and wisely decided that whatever protocols existed, they didn't apply here. The unit had 12 beds. Only 3 were occupied. Ethan Crawford was in bed 7. Nora approached slowly. Her hip ached from the helicopter ride from the sudden burst of activity after hours of sitting. She ignored it. Pain was just data. It couldn't stop her unless she let it. The boy looked impossibly young in the hospital bed, 19 years old according to his chart, but unconscious and intubated, he could have been 15. Blonde hair matted against his forehead with sweat and blood that the nurses hadn't quite managed to wash away. His face was swollen, bruised, purple, and yellow where the airbag had deployed at highway speeds. His chest rose and fell with mechanical precision, the ventilator breathing for him because his body had decided that consciousness was optional right now. Nora's eyes went to the monitors first. Heart rate 94, blood pressure 100/66, oxygen saturation 97%. The numbers were acceptable, stable for now. But she could see the subtle signs, the slight distension in his abdomen, visible even through the hospital gown, the way his blood pressure dipped every few minutes before stabilizing again like a boat taking on water and barely staying afloat. The faint yellow tinge to his skin that suggested liver function was compromised, and bile was starting to back up into places it shouldn't be. She pulled up his chart on the bedside computer, scanned the surgical notes from Sterling's damage control laparotomy 3 hours ago. The liver had been packed with surgical gauze. 4 packs total placed strategically to compress the laceration and slow the bleeding. Temporary measure. Buy time. Get the patient stable enough to survive the real repair, but the real repair would have to wait, because the liver was still bleeding, slowly, steadily, into the peritoneal cavity, and if they took him back to surgery now, if they tried to definitively fix the laceration without controlling the hemorrhage, first he'd bleed out on the table before they could get their hands on the torn organ. That's where Ari Boe came in. Resuscitative endovascular balloon occlusion of the aorta. It was a technique borrowed from combat medicine, from places where conventional surgery wasn't an option because you were working in the back of a moving vehicle, or in a bombed-out building, or in a field hospital with incoming mortar fire shaking dust from the ceiling. Places where you needed to control massive hemorrhage with minimal resources and maximum speed. The concept was elegant in its simplicity. Thread a balloon catheter up through the femoral artery in the groin. Guide it to the aorta, the body's main blood highway. Position it carefully in what they called Zone 1 just below the diaphragm. Then inflate the balloon, blocking blood flow to everything below that point. Cut off the blood supply to the bleeding organ. Give the surgical team time to work without the patient exsanguinating. Simple in concept. Brutally difficult in execution, because if you inflated the balloon wrong, you could rupture the aorta and kill the patient in seconds. If you positioned it wrong, you could cut off blood flow to the kidneys or the spinal cord, causing irreversible damage. If you left it inflated too long, you could cause massive ischemic injury to every organ below the balloon. The kidneys would shut down, the bowel would start to die. The whole lower half of the body would begin to necrotize from lack of oxygen. Margins of error measured in millimeters and minutes. Nora had done it 47 times. In Fallujah, in Kandahar, in places whose names were still classified and would remain so for decades. 47 times under conditions that would make a civilian surgeon's hands shake just thinking about it. She'd lost patients. Of course she had. You always lost some. But she'd saved more than she'd lost. And she'd learned what worked and what didn't, learned the feel of the catheter threading through tissue, learned the exact pressure needed to inflate the balloon, learned it in a way that couldn't be taught from textbooks or simulations, learned it the way you learned everything that mattered by doing it when failure meant death. Behind her footsteps, she turned. Dr. Sterling stood in the doorway. He'd changed into fresh scrubs. His hair was still damp from washing up after the surgery. His face was pale but set with determination, and his hands were tucked into his pockets again, hiding. "I reviewed the Riboe literature," he said. "No preamble, no small talk. Journal of Trauma, Military Medicine Protocols. I think I understand the basics." Nora looked at him, really looked. For the first time since they'd met, she saw past the arrogance and the privilege and the casual cruelty, saw a man who was scared, not for himself, for his patient, a man who'd just realized that everything he thought he knew might not be enough. Understanding the basics and doing the procedure are different things, Nora said. Her voice was neutral, not unkind, just factual. I know. Sterling pulled his hands from his pockets. Let her see them. They were trembling. Had been trembling for 18 years, ever since Kandahar, ever since the mortar attack, ever since the patient who died on his table while he froze. That's why you're here, to make sure I don't kill him. Nora studied the tremor, recognized it. The same tremor she had, the echo of trauma that never quite faded. You won't kill him, Nora said. Because you're going to do exactly what I tell you, exactly when I tell you. No improvisation, no ego, just follow instructions. Can you do that? Sterling met her eyes. For a long moment neither of them spoke. Then quietly he said, yes. Good. Nora turned back to the monitor. We have a window. His pressure is stable enough to attempt the procedure, but that won't last. The packs are degrading. Blood is soaking through. Within the next 2 hours he'll start bleeding again in earnest. When that happens, his pressure will drop fast. We need to be ready. How long does the procedure take? If everything goes right, 15 minutes from femoral stick to balloon inflation. If there are complications, longer. And the inflation time, how long can we leave the balloon up? Nora looked at the boy in the bed, at his young face, at the monitor tracking his heart, at the IV lines keeping him sedated and paralyzed and alive. 30 minutes, she said. Absolute maximum. After that, you start seeing ischemic damage to the organs below the balloon. Kidneys shut down first. Then bowel starts to necrotize. So we have 30 minutes to get in, pack the liver definitively, and get out. Sterling nodded slowly, processing. And if we can't fix it in 30 minutes, then we deflate and let him bleed while we work faster. Nora's voice was flat, matter of fact. But that's a last resort, because if we deflate, his pressure drops and we're right back where we started, except now we've used up our only ace. No pressure then, Sterling said, trying for humor, failing. Nora almost smiled. Almost. Let's prep, she said. I want everything ready. When his pressure drops, we won't have time to gather supplies. We move immediately. They spent the next 90 minutes preparing. Nora walked Sterling through every piece of equipment, the 7 French introducer sheath that would create stable access to the femoral artery, the guide wire thin and flexible that would find the path to the aorta, the balloon catheter itself slender and deceptively fragile-looking with its deflated balloon at the tip, the inflation device that would pump saline and contrast into the balloon, the fluoroscopy machine they'd use to visualize the catheter's position inside Ethan's body. She made Sterling practice. On a mannequin first, threading the wire, advancing the catheter, feeling the resistance, learning the subtle feedback that told you where you were in the vasculature, what tissue you were passing through when you'd reached your target. Sterling was a good student when he stopped trying to be the smartest person in the room. His hands were steady when he focused. His technique was careful, methodical. He asked questions, real questions, not the kind designed to show off, but the kind designed to learn. How do you know when you've reached the aorta, he asked, practicing the catheter advancement on the training model for the 3rd time. Feel, Nora said. The resistance changes. Femoral artery is smaller, tighter. When you hit the aorta, it opens up. The catheter moves more freely. You'll feel it. And if I go too far, you'll hit the heart. The catheter will start picking up cardiac motion. You'll see it on fluoroscopy. The tip will bounce with each heartbeat. Pull back until you're in the descending aorta just below the diaphragm. That's zone 1. How far below? Zone 1 is T11 to T12 vertebral level, just below the diaphragm above the celiac trunk. That's where we want to be for liver injuries. Cuts off blood flow to the abdomen, but preserves cardiac and pulmonary circulation. The patient can tolerate it longer. Sterling practiced again. His movements became smoother, more confident, but not cocky. There was a difference between confidence and arrogance, and for the first time in his career, Sterling was learning that difference. At 4:47 p.m., Sloane appeared in the doorway. Her face was pale. "Dr. Sterling?" His pressure just dropped, 85/48. Nora and Sterling looked at each other. "It's starting," Nora said. "Get him to the hybrid OR, now." The hybrid operating room was a fusion of surgical suite and interventional radiology lab. Sterile field, surgical lights bright enough to turn night into day, but also a massive C-arm fluoroscopy machine that could swing around the table, providing real-time X-ray imaging of what was happening inside the patient's body. Ethan Crawford was wheeled in, still unconscious, still intubated, still 19 years old and unaware that his life hung on a procedure most people had never heard of. The anesthesiologist, a woman named Dr. Patel, with steady hands and 20 years of experience keeping people alive while surgeons worked on them, took her position at the head of the table. "Pressure is 80/45, Patel said. Her voice was calm, professional, but Nora heard the tension underneath. Dropping slowly, "We have time, but not much." Nora stood to Sterling's right, not scrubbed in. She was still in her street clothes, observing from just outside the sterile field. Close enough to see everything. Close enough to talk Sterling through it. Close enough to stop him if he was about to make a fatal mistake. Sterling scrubbed, gowned, gloved. His hands were steady now. The tremor had disappeared, replaced by the focused calm of a surgeon who'd accepted what needed to be done. The surgical tech laid out the instruments. Everything Nora had specified. Everything in perfect order. A symphony of metal and plastic that would save a life or fail trying. Sterling approached the table, looked down at Ethan Crawford, the boy who'd been just another trauma case 4 hours ago, who was now the son of a senator, who was now the reason a former Navy lieutenant was standing in this OR instead of driving home in the rain. "Talk me through it," Sterling said, not looking at Nora, looking at the patient. Nora's voice was calm, clinical, the same voice she'd used in field hospitals with rounds impacting 100 meters away. The voice that had guided medics through procedures they'd never done before because there was no one else and someone had to try. "Palpate the femoral artery, right groin. You're looking for the pulse just below the inguinal ligament, between the pubic bone and the anterior superior iliac spine." Sterling's gloved fingers pressed into the surgical field, found the pulse, strong, regular. The body's main blood supply to the leg, now about to become their highway to the aorta. "Got it," Sterling said. "Mark it with a sterile marker. Then prep a 2-centimeter area around your mark. Betadine. We're going in percutaneously. No incision, just a needle stick. Clean and fast." Sterling prepped the site. His movements were precise, no wasted motion. Nora watched his hands, still steady, good. "Local anesthetic, 1% lidocaine. Raise a wheel, make it big enough. You don't want him feeling this when he wakes up." Sterling injected. The skin rose slightly, blanching white around the injection site. "Now the introducer needle, 18 gauge. You're going to stick at a 45-degree angle aiming toward the heart. You should feel the needle pop through the artery wall. 2 distinct pops if you're not careful, anterior wall, then posterior. We only want the anterior. Stop as soon as you get flashback." Sterling positioned the needle, took a breath, pressed forward. The needle advanced through skin, through fascia, through the layers of tissue that separated the outside world from the cardiovascular system. Then pop. "That's the anterior wall," Nora said. "Stop. Don't go through the back. If you go through both walls, you'll have a through-and-through puncture. Harder to thread the wire, higher risk of hematoma." Sterling stopped, pulled back the plunger on the syringe attached to the needle. Blood flashed back into the chamber, bright red, arterial blood, pulsing with each heartbeat. "Perfect," Nora said. "You're in. Now thread the guide wire. Soft end first. Gentle pressure. Let the wire find its own path. Don't force it. If you feel resistance, pull back slightly and redirect. Forcing it will create a false lumen and will lose the patient. Sterling picked up the guide wire. Thin, flexible. 1.5 meters of coiled metal with a soft atraumatic tip designed to navigate blood vessels without tearing them. He threaded it through the needle. On the fluoroscopy screen, the wire appeared as a bright white line snaking up through the darkness of Ethan's body. Up through the femoral artery, up through the external iliac, into the common iliac, into the aorta. The wire advanced smoothly. No resistance, no kinks, just clean advancement. Good, Nora said. Keep going. You want at least 50 centimeters in. That gives you working length and ensures you're well into the aorta. The wire kept advancing. 60 centimeters, 70, 80. On the screen, the wire tip reached the descending aorta, stopped just below the arch, just below where the diaphragm would be. Perfect position, Nora said. Now remove the needle. Leave the wire in place. The wire is your lifeline. Don't lose it. Sterling pulled the needle back over the wire. The wire stayed in place, a thin line connecting the outside world to Ethan's aorta. Introducer sheath next, 7 French. Thread it over the wire. You'll need to dilate the puncture site as you advance. Push firmly but smoothly. You'll feel resistance. That's normal. You're stretching the artery to accommodate the larger diameter. Sterling picked up the sheath. It was larger than the needle, stiffer, designed to create a stable access point through which the balloon catheter could pass. He threaded it over the wire, advanced it. There was more resistance now. The sheath was dilating the arterial puncture, stretching it. Sterling pushed steadily. Keep going, Nora said. Push until you feel it seat. Should be about 15 centimeters. Sterling pushed. The sheath advanced, seated with a subtle give that signaled it was in position. Good, wire out. Sheath stays. Use the side port to maintain access. Sterling removed the guide wire. Blood welled up from the sheath for a moment before the side port valve controlled it. Now the catheter. This is the critical part. Nora's voice was steady, teaching, guiding. The balloon is at the tip. It's deflated now. Radio-opaque markers will show you where it is on fluoro. You're going to thread this up to zone 1, T11 to T12, just below the diaphragm. I'll guide you. Sterling picked up the balloon catheter, longer than the wire, more rigid. At the tip was a small deflated balloon, invisible to the naked eye, but clearly marked on fluoroscopy. He threaded it through the sheath. On the screen, the catheter advanced up through the femoral, through the iliac, into the aorta. A bright line moving steadily upward through Ethan's body. Slower, Nora said. You're in the aorta now. Feel the resistance. That's blood flow. You're pushing against it. Normal. Keep advancing, but be gentle. The catheter crept upward, centimeter by centimeter, past the renal arteries, past the superior mesenteric artery, up toward the thoracic aorta. Stop, Nora said. Right there, T11. Perfect position for Zone 1 deployment. That's your sweet spot. Sterling stopped. His hands were rock steady now. Adrenaline and training had completely suppressed the tremor. Confirm position, Nora said. Patel, can you give us a deep breath? I want to see the diaphragm move. The anesthesiologist squeezed the ambu bag. Ethan's chest rose. On the fluoroscopy screen, the dome of the diaphragm descended slightly with the inspiration. The catheter tip was just below it. Maybe 1 centimeter, exactly where it needed to be. Perfect, Nora said. Now we wait. We don't inflate until Dr. Kim is ready to operate. Once that balloon goes up, the 30-minute clock starts. There's no pausing it. Sterling nodded, stepped back from the table. His gown was damp with sweat despite the cool OR temperature. Across the table, Dr. Kim, the hepatobiliary surgeon who'd been called in specifically for this case, was scrubbing. She was 55, Korean, had been doing liver surgery for 25 years, and had seen everything. But she'd never worked on a patient with Reboa before. This is going to be amazing, Kim said, drying her hands. I've read about this technique. Never thought I'd see it in a civilian hospital. Let's hope it works, Sterling said. It'll work, Nora said. Not confident, just certain. The certainty of someone who'd done this 47 times. Ready, Sterling took a breath. Ready? Patel, what's his pressure? 72/36, the anesthesiologist said. Still dropping. How long until he's unstable? 5 minutes, maybe less. Nora looked at Sterling. Inflate the balloon, slowly. 10 cc's of saline contrast mix. Watch the pressure gauge. You want 8 atmospheres. That's the sweet spot. Less than 8, you won't get complete occlusion. More than 8, you risk aortic rupture. Sterling picked up the inflation device. It looked like a large syringe filled with saline and contrast medium. The contrast would make the balloon visible on fluoroscopy. He attached it to the catheter port. Inflating now. He pushed the plunger, slowly, steadily, 1 cubic centimeter at a time. On fluoroscopy, the balloon began to expand, a small sphere growing larger with each increment of fluid. It expanded against the aorta walls, filling the lumen-blocking blood flow. The pressure gauge on the inflation device climbed. 4 atmospheres, 6, 7, 8, Sterling said. Stop, Nora said. Hold pressure right there. Patel, what are we seeing? The anesthesiologist watched her monitors. For 3 seconds, nothing changed. Then dramatically, the blood pressure began to climb. 72/36, 80/43, 92/52, 100/58. We have occlusion, Patel said. There was wonder in her voice, genuine awe. Pressure is normalizing, heart rate steady. This is incredible. Below the balloon, blood flow to the abdomen had stopped completely. The liver was no longer receiving blood, which meant it was no longer bleeding. The surgical team had their window. Dr. Kim stepped to the table. Starting now, 30-minute clock. Someone hit the timer. It beeped once and began counting down on the OR screen. 30, 00, 29, 59, 29, 58. Dr. Kim made the incision, reopened Sterling's original damage control laparotomy. The abdomen opened like a book, revealing secrets written in blood. The packing material was visible, soaked, dark red. Removing packs, Kim said. She pulled them out one by one. Normally this would cause massive hemorrhage. Normally blood would pour out the moment the packs were removed, making it impossible to see what you were working with. But with the balloon inflated with the aorta occluded, there was only minimal bleeding. Just the slow ooze of venous blood that could be easily controlled with suction. Beautiful, Kim muttered. This is beautiful. I can actually see the anatomy. She began the repair, careful, methodical, suturing the torn liver tissue with precision that came from thousands of hours of practice, using special techniques developed specifically for high-grade liver lacerations. The tear was deep, nearly severing the right lobe from the left, but with the bleeding controlled, Kim could work. Sterling stood across from her, assisting, retracting, suctioning, watching a master surgeon work, learning. The timer counted down. 25:00, 20:00, 15:00. Almost there, Kim said. Her voice was tight, focused. Just need to get this last arterial feeder ligated. 10:00. The room was silent except for the beeping timer and the soft hiss of the ventilator. 5:00. Done, Kim said. Liver is packed and repaired. Close him up. Sterling looked at Nora. She nodded. Deflating balloon, Sterling said. He pulled back on the inflation syringe, slowly. The balloon collapsed. Blood flow returned to the abdomen. Everyone watched the monitors. The blood pressure held. 94/52, stable. No bleeding from the liver repair. The timer hit 0 and beeped. The OR erupted in quiet celebration. No cheering, not professional, just sighs of relief, shoulders dropping. The surgical tech closed her eyes for a moment, exhaling tension. Sterling removed the catheter, pulled it back through the sheath, through the artery, out of Ethan's body. applied manual pressure to the groin puncture site. 5 minutes of compression to ensure hemostasis, to make sure the artery sealed properly. When he stepped back, his hands were finally shaking again. "You did it," Nora said quietly. Sterling looked at her, looked at this woman he'd mocked and fired and dismissed as a janitor. This woman who'd just guided him through the most complex procedure of his career. This woman who'd saved his patient's life. "We did it," he said. Nora didn't correct him, because in a way he was right. It had taken both of them, her knowledge, his hands, both willing to set ego aside and focus on what mattered, saving the kid. Senator Richard Crawford arrived at Grace Memorial Hospital at 6:14 p.m. He came with a motorcade, 3 black SUVs, Capitol Police, an aide carrying a briefing folder that probably contained crisis management scenarios for "What if my son dies?" Nora watched from the 4th-floor window as the senator emerged from the lead vehicle. He was 62, silver hair that looked good on television, the kind of face that won elections. But right now that face was tight with fear, with the particular terror of a parent whose child is in danger, and there's nothing money or power or political capital can do about it. Commander Stone met him in the lobby. Nora couldn't hear the words, but she could read the body language. Stone's calm professionalism, the senator's desperate need for information. The moment Stone nodded toward the 4th floor, and the senator's shoulders sagged with relief. They were coming up. Nora stepped back from the window. She was still in her civilian clothes now, dry but wrinkled. She looked like someone who'd been through something, which was accurate. Behind her, the door opened. Footsteps. Multiple people. She turned. Senator Crawford, Stone, Hartwell, and Dr. Sterling. The senator's eyes swept past Nora without recognition, looking for a doctor, looking for someone in authority, someone who looked like they'd just saved his son's life. "Where is my son?" Crawford's voice was controlled, but barely, the voice of a man holding himself together through sheer will. "How is he?" Sterling stepped forward. For a moment, Nora thought he was going to take credit, going to claim the save, going to do what he'd always done, accept praise that wasn't entirely his. But Sterling surprised her. "Senator Crawford," he said, "I'm Dr. Marcus Sterling. Your son is stable. We just completed a complex procedure called REBOA to repair his liver injury. The prognosis is excellent. Barring complications, he should make a full recovery." Crawford's knees nearly buckled. He grabbed the back of a chair. "He's going to live." "Yes, sir." The senator closed his eyes, took 3 deep breaths. When he opened them again, they were wet. "Thank you," he said. His voice broke. "Thank you, doctor. I don't know how to thank you." Sterling opened his mouth, then closed it, looked at Nora, looked back at the senator. "Senator," Sterling said, "I performed the procedure, but I need you to understand something. I'd never done a REBOA before today. I learned it this afternoon. And the only reason your son is alive is because of her." He gestured to Nora. Crawford looked at her, really looked, taking in the civilian clothes, the gray hair, the way she stood wait on one leg. "Who are you?" he asked. Stone stepped forward. "Senator Crawford, this is Lieutenant Nora Kincaid, retired Navy combat medic, call sign Valkyrie." She taught Dr. Sterling the procedure, walked him through every step. Without her, we'd be having a very different conversation right now. Crawford stared at Nora, then at Hartwell, then back at Nora. "You're not staff here?" he asked. "Not anymore," Nora said. "I was terminated 4 hours before your son arrived." The silence was absolute. Crawford's head turned slowly to Hartwell. "Terminated." "There was a misunderstanding," Hartwell stammered. "A personnel issue. But we immediately—" "You fired the person who saved my son's life." Crawford's voice had dropped, quiet now, the kind of quiet that preceded political destruction. 4 hours before he needed her. "We've offered to reinstate her employment," Hartwell said quickly. "Full benefits, back pay, promotion to—" "I didn't accept," Nora interrupted. "I supervised Dr. Sterling as a professional courtesy, not as an employee of this hospital." Crawford looked at her for a long moment. Then he held out his hand. "Lieutenant Kincaid, I owe you a debt I can never repay, but I'd like to try. Name it. Anything." "What do you want?" Nora thought about it. Thought about all the things she could ask for. Money, influence, revenge. But she didn't want any of that. "I want you to visit the VA hospital in La Jolla," she said. "Talk to the veterans there. The ones with PTSD and TBI and missing limbs. The ones who came home and can't find work because they're too old or too damaged or don't fit the culture. I want you to remember that they're not broken. They're experienced. And maybe, Senator, you could help change the way this country sees them." Crawford nodded slowly. "I can do that. I will do that. You have my word. That's all I want." The senator shook her hand. His grip was firm, grateful. "Thank you, Lieutenant, for my son, for your service, for everything." He moved past them all, heading toward the ICU to see Ethan. When he was gone, Hartwell practically fled, mumbling about phone calls and damage control and board meetings. Sterling remained. He looked at Nora for a long moment. "I was wrong about you," he said finally. "I was wrong about a lot of things." "Yes," Nora said. "You were. I don't expect forgiveness." "Good. Because you won't get it. Not yet. Maybe not ever." Sterling nodded. "Fair enough." He turned to leave, stopped at the door. "If you ever want to come back, to teach, the offer stands." Nora didn't answer. Sterling left. She was alone with Stone. The commander walked to the window, looked out at the parking lot, at his helicopters on the front lawn, at the gathering crowd of media trucks that had caught wind of the story. "Job offer still stands," Stone said. "We need combat medic instructors at Coronado, people who've actually done it, not people who've read about it in journals." "I'm retired," Nora said. "You keep saying that, but you showed up today. You saved that kid. You taught Sterling. That doesn't sound retired to me. That sounds like Valkyrie." Nora joined him at the window, looked at her reflection. 52 years old, gray hair, scars visible and invisible. "I don't know what I am anymore," she said honestly. Stone smiled. "Then figure it out. Take your time. When you do call me." He handed her a card, plain white, just a phone number. Then he left, boots echoing down the hallway. Nora stood alone in the fourth-floor lounge. Outside the sun was setting. The rain had cleared. The sky was that particular shade of orange and purple that California did better than anywhere else. She had choices now. Options. Doors opening instead of closing. Stone's offer. Teaching operators. The VA hospital. Dr. Evelyn Marsh had been trying to recruit her for 2 years. Or something else entirely. For the first time in 5 years, the future felt like possibility instead of just more silence. Epilogue. 6 months later. The conference room at Grace Memorial Hospital was packed with 30 young doctors in neat rows, tablets out, attention, focused on the woman at the front of the room. Nora stood beside a projection screen showing a trauma x-ray. Her hair was shorter now. Professional. She wore navy blue scrubs with a name tag that read, N. Kincaid, Director of Trauma Education. 3 days a week here, 2 days at the VA in La Jolla, training the next generation, passing on what she'd learned in places most of them would never see. This patient arrived with a GCS of 3 and BP of 60/30, Nora said. First priority, hands shot up. A resident in the front row, airway. Good. But before that, silence. You listen, Nora said. Listen to the paramedics. Listen to what the injuries are telling you, because trauma patients will tell you what's wrong if you pay attention. She clicked through slides. The residents took notes, asked questions, smart questions. In the back row, Sloan sat with her tablet. She'd been promoted to trauma charge nurse. Part of her role, observed Nora's teaching sessions. Next to her, Bryce, now a second-year resident. He'd requested to work with Nora specifically. The session ended. Residents filed out. Sloan and Bryce approached with questions. Nora answered patiently. When they left, Nora packed up her materials, checked her phone. One new message from Commander Stone. New training cycle starts Monday. 12 PJ candidates. Could use your expertise for REBOA module. Interested. She smiled. Typed back, I'll be there 0600. She drove across town to the VA hospital, parked in her reserved spot. Inside she had 2 hours of training scheduled, teaching young medics the things textbooks couldn't capture. At 5 p.m. she left, drove home. Her apartment was small, but hers. Inside she made tea, sat on the couch, opened her laptop. A knock at the door. Unusual. She didn't get visitors. She opened it. Commander Stone stood there, not in uniform, jeans, jacket. He looked uncomfortable. He held a manila envelope, classified markings, red stripe. Lieutenant, sorry to drop by unannounced. Commander, what's wrong? Stone held up the envelope. Something came across my desk. Thought you should see it. Nora took it, opened it. Inside photos, satellite imagery, a compound somewhere in Eastern Europe. And faces. Faces she recognized. Her blood went cold. Blackwell Corporation executives, the PMC that had run illegal operations in Kandahar, the ones who'd set up the ambush that killed her convoy in 2020, the ones who'd killed 3 of her teammates, the ones who'd walked away clean because their contracts were buried under layers of classification. Stone's voice was quiet. They're still operating. New name, Aegis International, same people, trafficking weapons to prohibited groups, destabilizing regions for profit. We have a task force forming. Joint ops with CIA. We need someone who knows their tactics, someone who's faced them and survived. Nora stared at the photos, at the face of the man who'd given the order. Marcus Reeve, former Delta, now a war profiteer. Why me? She asked. Because you're the only one who's seen their playbook, because you know how they think, and because, Stone met her eyes, because you deserve to be the one who brings them down. Nora looked at the envelope, at the faces, at the chance for justice she'd thought would never come. She closed the folder, handed it back. I'm a teacher now, Commander. That's my mission. Stone nodded slowly, started to turn. But, Nora said, if you need a consultant, someone to brief your team on Blackwell tactics, how they operate, where they're vulnerable, I can do that. Stone smiled. That's all I'm asking. He left the envelope on her table. After he was gone, Nora opened it again, looked at the faces. 20 years of war, 5 years of silence, and now maybe closure. She picked up her phone, called Evelyn at the VA. It's Nora, that training program you mentioned, the one for operators going after PMCs. I'm in. What changed your mind? Nora looked at the photos, at Ranger's picture on her desk. Unfinished business. She hung up, closed the folder. Tomorrow she'd teach doctors how to save lives. But soon she'd teach operators how to end threats. Balance. That's what Valkyries did. They chose who lived and who died. Epilogue 2. The Strip Mall. 2 weeks later, East County, San Diego. The strip mall was tired. Wedged between a nail salon and a vape shop, a small storefront with a hand-painted sign, Sterling Medical Aesthetics, Botox and Fillers. Inside, Marcus Sterling sat at a desk from IKEA. On the wall, his Johns Hopkins diploma, framed, but the frame had cost $15 at Target. The door chimed. A woman entered, mid-40s, worried eyes. Doctor. Sterling. I have a 3 o'clock, 4 headlines. Sterling stood, smiled professionally. Of course, please have a seat. He prepped the syringe. 20 units of Botox, simple procedure. He picked up the syringe. His hands trembled. The woman noticed. Doctor, are you okay? Sterling set down the syringe, took a breath, picked it up. Fine, he said. Just fine. He injected. Perfect technique. Years of training. But his hands never stopped shaking. The woman left uncertain. Sterling cleaned up. His phone buzzed. Text from the medical board. License restriction remains in effect. No surgical privileges. Cosmetic procedures only. Review 2027. He looked at his diploma. Yale. Johns Hopkins. chief of trauma surgery. Now this. His hands shook. They would always shake, for all the combat medics who served in silence, for all the veterans who came home invisible, for all the Valkyries who chose who lived. You were never janitors, you were always heroes.